The following program is brought to you courtesy of a grant provided by the Bank of Princeton.
Good evening, I'm Lou Goldstein and welcome to another edition of Focus On. Tonight our focus is on Heart Disease Awareness Month. February is Heart Awareness Disease Month, and I'd like to have two special people who have agreed to come on tonight's show. They are Dr. Aaliyah Brown, who's a cardiologist, and Lynn Bogerhausen, who is a heart survivor. And one of the things that we'll be talking about is ways not only to maintain your health and exercise and prevent any type of heart disease, but also we'll be focusing on some of the causes and when you should go see a cardiologist if you're having any type of unusual pain or things that you should be doing to prevent, having to wind up in an emergency room when you least expect it. So Aaliyah and Lynn, thank you very much for coming on the show tonight.
Thank you for having us.
Let me just give a short background on Dr. Brown. Dr. Brown graduated from the New York College of Osteopathic Medicine in 1997. She went on to study in the St. Barnabas Healthcare System at Union Hospital in Union and completed a 3-year residency in internal medicine in 2000. Dr. Brown then went on to a non-invasive cardiology fellowship at the Bora Heart and Lung Center. This was completed in 2003. The following year, she joined the staff of Huntington Cardiovascular Associates, where she served as an attending cardiologist and the director of the Heart Failure Center. In 2007, Dr. Brown moved back to Deborah Heart and Lung Center, where she helped develop outreach primary care centers for the institution. 2 years ago, in the summer of 2009, Dr. Brown decided to step out on her own and founded Central Jersey Heart Group, LLC. This practice is dedicated to fulfilling the needs in Ewing, Trenton, Hopewell Valley, and the surrounding communities in the area. So that's a great thing. I know, Lynn, you have a very personal story, which we'll be getting to, about symptoms that you felt one day about 4 or 5 years ago, and how you managed to survive your heart attack. And so we'll get to that. But the first thing I'd like to ask you is, for families, what type of activities should parents encourage their children to do in order to mitigate heart disease later in life? We're hearing a lot about childhood obesity, and there's a lot of focus on that. So what type of activities should parents be encouraging their children to work on?
Children should be as active as they can. Whatever activities they enjoy doing, I always encourage them to find a way for their children to do it. These days, diabetes is endemic in the young population. We're seeing diabetes occurring much younger than we did before, as well as heart disease. In the 30s and 40s, we're seeing more people presenting with heart attacks and coronary artery disease. So to start your child early in some form of exercise program, whether it's competitive sports with soccer and football and basketball, or whether it's just every day making sure that your child is doing at least 30 minutes to an hour of some form of activity. Our schools are not necessarily requiring gym every day. So since the children are not doing gym every day, we have to make sure as a family, as their parents, to make sure that they're as active as they can be. Taekwondo after school, basketball practice and games, soccer, whatever sport you name it, swimming, just get them as active as possible. That'll reduce their risk in the future.
That's fair. What type of heart conditions are children most susceptible to?
Children are most susceptible to congenital heart disease. We don't see it as often as we used to, but congenital heart disease is the #1 reason why a child is seeing a cardiologist. After that, children also have irregular heart rhythms that can cause palpitations. They also can be born with congenital thickening of the heart muscle, which we see our young patients dying from sudden death on the football field. So if there's any family history of heart disease where sudden death in the family or underlying irregular heart rhythms in the family, those children should be seen sooner rather than later. There are other conditions where families may have heart disease, irregular heart rhythms, or sudden death. Those children should be screened in their preteen and teen years for underlying heart disease.
Okay. And how about adults? What is the ideal daily routine to keep the risk of heart disease at a minimum?
So the daily routine is first starting out every morning with a healthy diet. Eating breakfast is so important. So a breakfast that is rich in protein, rich in multigrain breads, rich in fruit and vegetables is very important. Other things that we need to do is make sure that we're not eating a lot of red meats, a lot of fatty foods, having a well planned out and proportioned meal. And then thirdly, we need to be exercising. So the bare minimum exercise is 30 minutes most days meaning 4 days per week.
Okay.
I generally recommend 30 minutes of cardiovascular exercise 5 days per week, plus 2 days of some lightweight training, so some resistance training, whether you're doing bands or light weights, whether you're doing yoga or Pilates, but twice a week you should be doing that. That increases your metabolism, builds up that healthy fat and muscle, and it really helps reduce your overall fat within the body itself.
How about swimming? Is swimming good for you?
Swimming is the best exercise for you because it works everything. It works your lungs out, it works your muscles out, it works your breathing out and your heart. So swimming is one of the best exercises out there. And then as we get older, we may not be able to walk on a treadmill because we have arthritis, our joints may be hurting, and swimming reduces all of that weight on our muscles. So we're able to actually do more in the swimming pool.
There's no resistance.
The resistance is not there. So many programs out there. Water aerobics are fantastic, especially as we get older, because you're able to do so much more than just trying to get on the treadmill and having to stop in 10 minutes because your knees and hips and everything else is hurting.
It's true. It's true. And we're always getting younger each day, right?
Younger each day.
There we go. Now, Lynn, I know that you have a very personal story that hopefully you can share with us, and maybe you can tell us exactly what happened, back in 2007 to you, and sequence of events that led you to realize that you were actually having a heart attack.
Sure, I'm thrilled to be here to be able to share that story because it's very important to me to make sure that people understand that what happened to me could happen to just about anybody. I mean, basically, about 5 years ago, in 2007, I woke up in the morning feeling like I had the flu, and by the end of the day realized that I was going to be spending the night awake in a hospital room because I had just had a heart attack at the age of 40 because a piece of plaque had broken off and blocked an artery 90%. And they had to go in and do an angioplasty to clear the blockage and then put in a stent to hold the artery open. And I had no idea that that was ever even a possibility. I, at that point in my life, didn't have any of the classic background that you hear about. My blood pressure was always good. My cholesterol was always good. I was eating what I thought was a healthy meal every day. I was taking care of myself. I was exercising. And yet, I still ended up having a heart attack. So it can happen to anyone. And people need to understand that you need to learn about yourself and know when you're feeling good so that you can have a better understanding of when something is really, truly wrong. I was very lucky the day that I had my heart attack because through a series of events throughout the day and going to work and having someone there with me at the time that it happened, instead of being alone in my house, allowed me to have someone else who could take me somewhere when I started not to feel well again. And all I had were dizzy spells. I had dizzy spells and some soreness in my arms.
Right.
I had gotten a
flu shot.
Flu shot and a pneumonia shot right before it happened, and I woke up 2 days later with some stiffness, which is expected. Most people that get a flu shot will know that they feel like they have the flu afterwards. So I didn't think anything unusual about it. I called my doctor's office. I asked them about it. They didn't think it was unusual. They also thought that it was symptoms from having one shot in each arm that year. And they said, if it doesn't go away, call us back. I went to work. I decided it wasn't worth taking a sick day and drove all the way from Phillipsburg down to Bridgewater, made it up 2 flights of stairs, got to the top of the 2nd flight of stairs, felt tired, but that was it. Still never had any chest pain, never had any pain in my jaw. There was no tingling in my arm. There was no throbbing in my back. None of the things that you see or hear about in movies. People think they would know when they were having a heart attack, but you really don't. For many, many people, you don't even know that you're having the symptoms until someone is telling you that you're having a heart attack. When the cardiologist told me at the hospital that I was having a heart attack, I was actually arguing with him. I was laying on the gurney and I said, "No, I'm not." And he said, "Yes, you are."
So you didn't have any shortness of breath not to argue with him then?
No,
Yeah.
no. I would have thought that I was fine. And he said, you're far from fine. And I was only 40 years old. You know, it was a huge wake-up call. I was very, very fortunate that the doctor at the MediMerge clinic knew enough about heart disease and enough in particularly about the symptoms that women have when they're having a heart attack to think this is not a reaction to a flu shot. This is not indigestion. This is not so many of the other things that it often gets diagnosed as. Let me do an EKG and see what's going on. I think something else may be going on. And because he did that, that started the process in motion to get me to the hospital.
Exactly.
Well, the point I was going to just follow up maybe with Dr. Brown is, are there different symptoms in women and men that they lead them to believe that they're having a heart attack?
Yes, there are. And Lynn's story is so important because as she told her story, she told you all classic male symptoms that she did not have. Chest pain, shortness of breath, palpitations. She did not have any of those classic symptoms, and most women do not. If you look at the literature, only about 45% of women will have chest pain or any pounding in their chest at all. So that is not a classic symptom. Nausea, dizziness, shortness of breath, fatigue, very common symptoms for women. So lots of times women will say, I thought I had the flu and I went to bed, and some of them don't wake up. And unfortunately, another very important thing that Lynn said was that lots of times they do go and see their primary doctor, and the primary doctor may not even suspect that they may be having a heart attack and may send them home and say it is due to the flu, or we don't think there's anything else going on. And her primary doctor at the Medi Center did the most important thing. He suspected that her symptoms could be due to something else and sent her appropriately to the emergency room.
Right.
And that's where we need to be.
So we
More
need to be proactive, rule things out, rather
Absolutely.
than rule them out and
Not do anything
Right.
at all.
Right. I think one of the questions I want to follow up on, we talked about this, about some of the differences, but also a lot of times we talk about diet and exercise as helping to reduce the possibility of heart attack. The other part is, what factors do like stress and anxiety and emotional strains play on the ability to not have a heart attack but contribute down the road to a heart attack?
Right. So when we talk about what are the risk factors for heart disease, and we talk about high blood pressure, having high cholesterol, having diabetes, a sedentary lifestyle, and a poor diet, having high cholesterol levels. When we talk also about stress, how does stress play a part in all of that? Stress increases certain hormones in our body that increases our overall risk for hypertension and having high blood pressure, as well as poor dietary habits with binge eating and increasing your cholesterol levels and increasing your abdominal fat, because stress increases cortisol levels. That cortisol level that is increased around the belly causes you to have increased abdominal fat and increased cholesterol levels. So also, other things that stress does is it increases other hormones that increases our heart rate and then increases our blood pressure. So all of those are added things into our system that increase our risk for having a heart attack and having coronary artery disease by hardening arteries from high cholesterol levels. Stress can also, really severe, significant stress can also cause you to have a heart attack. We have seen people who have normal underlying coronary arteries who have a significant stressor, whether it is a death of a family member or whether it is a very traumatic event, and they can present to the hospital having an acute heart attack from all of the increase in the enzymes in their bodies. So stress does play a significant factor in causing heart disease. And things that we know really work is that exercise we talked about. There have been studies who have been giving medications to people who have significant anxiety and depression. We give them medication for anxiety and depression or recommend exercise, good old exercise that costs nothing and has no side effects in general. And we find that people actually do about the same.
Yep.
Absolutely. So I always recommend exercise to my stressed out women who come in with many different symptoms and we find everything is fine. Prescription, get out and exercise, clear your mind. It's definitely beneficial to you.
That's good. What about genetics, the role of genetics? I asked this for a personal reason too. You know, both my parents had bypass operations, multiple bypass operations. They both have had pacemakers. There's a history of heart issues, even though my father's a very active guy. You know, he was a very active guy, so was my mom. She was a swimmer. My dad was very active too. Am I at risk due to genetics of following in their footsteps?
Well, what we do find is that most, I will say, of our young patients who come in who have been very active and being very healthy, if we look down the line, it's a significant family history that causes them to have premature underlying coronary disease. So when we talk about what your risk is, if your mother had a heart attack or your sister had a heart attack in their 50s, or if your father had a heart attack or your brother had a heart attack in his 40s, 45, 55, that puts you at a much higher risk than someone whose parents or first-degree relative had their heart attack later on. So 55 for a male is not a significant risk, or 65 or older for a woman is not a significant risk. So genetics plays a significant part, and predominantly it's related to high cholesterol levels as well as hypertension or just premature coronary disease from both of those together.
Now, is there any truth regarding salt in diets? Is there anything that we should know about salt?
Absolutely. Salt, we know, that, increases your blood pressure.
Right.
There are lots of people out there, predominantly in the African American community, who are very salt sensitive. If they put salt in their foods and they have hypertension, their blood pressure will escalate almost immediately. Right. So salt sensitivity is definitely out there in terms of your blood pressure. So having a high sodium diet definitely increases your blood pressure. That increase in your blood pressure causes your heart to work that much harder. And since your heart is working harder, it adds undue stress on the muscle of the heart, because it is a muscle.
I'm going to turn to Lynn for this question.
Sure.
And it's an unusual question. I could ask the doctor, but how often do you think everybody should go see a cardiologist?
That's a really good question. I think you should definitely go to see your doctor at least once a year.
Okay.
I think the time to see a cardiologist is when you start to learn more about yourself and you learn about your family history. If you know that there's a family history and you know that you yourself are either not taking care of yourself, you're overweight, you're sedentary, you're not getting out, you're not moving, you don't eat well, then I definitely think that you need to go and have some tests done that maybe your regular primary care physician would not normally do. And find out. The worst case scenario is you find out that you're okay. You know, and there's no harm in finding out that you're okay, because that's your baseline. And now you know what your numbers are, you know what your cholesterol is, you know what your blood pressure is, so you know what you're watching, you know, and you'll know when it's wrong. So I don't think that there is necessarily a right time for everyone to have a cardiologist, but I think you need to figure out what is right for your specific situation, and then once you do, you need to see them regularly. We can't push off to the side that, you know, I'll go to the doctor when I have more time, or when I'm not feeling well, or when the kids don't have soccer practice, or when I don't have the PTA meeting, or I'm not doing a huge project at work, because we consistently put ourselves last, and eventually you're going to be putting yourself really at the bottom, because you're not going to be any good to anyone else if you're not here.
That's true. That's true. It doesn't help. And when you had your heart attack, had you gone to your primary physician prior to that with any other types of similar pains or anything like that?
At the time that this happened, I hadn't experienced anything that would lead me to believe that I was down on this path. As I said, my numbers were good at that point, and I wasn't concerned, and they didn't have a concern. But there is a history in my family, a history that we weren't really paying that close attention to. My father had a heart attack in his 50s. My mother and my sister had always had heart palpitations. I felt that since I never had them, that I must be okay. And so I really wasn't thinking about it. And this event changed all of that and made me realize that one of the most important things that we can do is help to educate people on the fact that this is the way it is. And the reason that heart disease is the #1 killer is because so many people, even with all the information that's out there, are still so uninformed about how this disease can affect them. And statistics show that 80% of cardiac events can be avoided by reducing the risk factors, which means we just have to let people know what they need to do to reduce the risk factors.
So it's really all about education.
Yeah, we need to help people understand that they are empowered to help themselves. Little changes, even if you go from doing nothing to going to 15 minutes of exercise, 30 minutes of exercise a day, changing a few things in your diet, eliminating some of the fats, eliminating some of the salt, little things that you can do to change your overall lifestyle will make a huge difference.
So you have to take stock in yourself.
Absolutely. You have to make yourself important enough that, and realize that you can't continue to care and love everyone else in your life if you're not taking care of yourself, because you won't be there.
Right.
You just won't be there.
Now, you've been involved with the American Heart Association, and I guess you got involved because of what happened to you. But I'm sure you're sharing your personal story, which is much appreciated. And hopefully, everybody at home who's listening tonight will be taking stock and taking notice of this. And what is the mission of the American Heart Association as far as its educational philosophy?
The mission of the organization is really very simple: to help people understand the risks of heart disease and help to prevent and continue to research heart disease, and make sure that everyone that we can speak to has an understanding of what the disease is all about and what they can do to know their risks and help prevent it. So it's all about education, it's all about research, it's all about advocacy, going to our government and making sure that they continue to fund programs for healthcare reform and for taking care of our kids in schools, getting the bad food out, getting the good food in, making sure that they're not doing away with the gym classes and the exercise programs, and continuing to lobby for our congresspeople to make things happen.
From the menu that they're serving in the cafeteria to making sure that those after-school programs include some type of sports activities, that's what the AHA stands for. So if they can get the word out to, as we had talked earlier, starting off, to our young counterparts that we are producing to make sure that we can reduce their overall risk in the future, from starting there to doing fundraising to get more research done to prevent disease and to treat disease more successfully. That's what the AHA is all about, trying to do.
Okay. Now, how should, as a cardiologist, you see patients all the time, and you have them on the treadmills for stress tests,
Yes.
And various other tests too. How should an individual prepare when they come to see you? Is there something that they should do and write down, or, in other words, what information do you elicit that you would like people to come prepared when they see you?
So we want to know all of their risk factors. So most importantly, Linda mentioned one very good, is that know your family history and really take onus on that. Unfortunately, in our families, we don't talk as much as we should. So we don't know that mom saw the cardiologist at 52 and had a stress test and maybe even had something done, but we don't know. We know that, oh, she's got a little heart condition, but we don't know what it is. So most importantly is knowing their family history, and then figuring out what your risks are. So smoking is a significant risk factor. If you smoke, your risk increases 7 times the normal risk of smoking. Is there a family history of diabetes, and what are you eating? What are you doing to try to prevent that? So know what your numbers are. So the American Heart Association has a little card that I love giving to my patients. What are your numbers? What was your last cholesterol? When did you have your first EKG? Have you ever had any testing on your heart, or even your parents? Have they seen a cardiologist? What are all of those things? So I ask a lot of different questions. Family history, most important. Risk factors, smoking, alcohol, what are you doing with that? Are you exercising? Have you had recent blood work? Have you ever had an EKG? All of those types of things I ask on the first visit, because I want to know if their risk is you're going to have a heart attack tomorrow, or listen, we need to do these things to prevent your overall risk for dying early.
Right. Now you mentioned alcohol and smoking, and
Yes.
excessive alcohol and smoking.
Yes.
What do we mean by when we say excessive? Everybody has a different, line about what excessive means to them. But overall, as a generic statement, when we say excessive smoking, excessive drinking of alcohol, what are we talking about?
So excessive smoking is actually any smoking.
Okay.
Even secondhand smoking, we know, can increase your risk for plaque formation sooner rather than later. Okay. When we talk about alcohol, we don't normally like to give that recommendation out because we don't want anyone to say, "Oh, I can drink," and they're susceptible for overindulging. So women generally can have one alcoholic beverage a day. That means 1 6-ounce glass of wine, 1 4-ounce glass of a shot of whiskey, 1 12-ounce beer, 1 per day, and for men 2. So we know that 1 alcoholic beverage for a woman and 2 for a man has not been shown to increase your risk for hypertension, for a weakened heart muscle, or for coronary artery disease. So that would be the limit.
Okay.
Now that doesn't mean 14 on Sunday.
Okay.
Get your
I was going to ask you,
in.
can you make it all up in one day?
Exactly. No.
Can't go all in one day. Okay.
And also some of the most recent literature has shown too is that the binge drinking, it hasn't shown to be any benefit at all. So if you just drink on the weekends, occasionally, very socially or light, there's no benefit. But we do know that 4 to 6 ounces of wine, red wine more particularly, definitely reduces your risk, reduces your cholesterol, and reduces your overall risk for heart disease.
Okay. Good to know.
Mm-hmm.
Good to keep in mind.
Exactly.
Now, what advice, Lynn, would you give to somebody who has had a heart attack and is worried about the quality of their life afterwards?
You can do anything that you put your mind to. My cardiologist tells me every time he sees me that if he didn't know that I had a heart attack, he would think that I was the poster child for clean, healthy living. Mm-hmm. The only thing that's going to stop you is you. So what you need to do is you need to focus on yourself at that point. You need to see it for what it was. There was a wake-up call. It was something telling you, if you've survived it, that you are now supposed to be here. And now you have a chance to make a difference and change what you were doing before for the better. So you need to start exercising, you need to start eating right, and you need to start doing what you need to do to take care of yourself and anyone else that's important to you. And everything else is going to be the sky's the limit, because it won't stop you.
Okay. I see we have just a couple seconds left, but before we go off the air, I know there's an event coming up on
Yes.
February 23rd, I believe. Maybe Dr. Brown, you could talk a little bit about that?
Absolutely. For the last 3 years, I've done an event where we invite women, my practice, women in the Ewing, Hopewell community to come out and talk about heart disease. So I have a lecture series from 6 to 8:30 at Hopewell Valley Golf Club. We'll be talking about getting yourself together. So we're asking women to come out and just talk about heart disease. We'll have someone talking about getting the finances together. We'll also be talking about how to de-stress your life and how to feel better about yourself. So come on out, 6 to 8:30 at Hopewell Valley Golf Club, and it's an event sponsored by my practice and Sandra's Skin and Body Care in Hopewell.
Okay, great. Well, Aaliyah, thank you very much for coming on, and Lynn, thank you very much for coming on. Both very informative, and hopefully everybody who's watching tonight will realize that February is Heart Disease Awareness Month, and if you're having any symptoms that you're even thinking about may be unusual, see your doctor, your primary physician, and let him or her direct you to a cardiologist if necessary. But don't sit there and say it'll pass, because the life you save may be your own. So this for Focus On. This is Lou Goldstein, hoping that you stay healthy, stay involved, stay fit, get some exercise, and I'll see you next week for another edition. Have a good evening.
This program was brought to you through a grant provided by the Bank of Princeton.